Hi, I'm Dr. Alan Bachrach. I am a retired neurologist, and I'm a strong supporter of Insure Tennessee. There are multiple reasons for this. First of all, the federal government is distributing many millions of dollars across the country, which were originally required by the Affordable Care Act, and now it's no longer required, and our governors can turn down the money. But most states, or many states, are accepting the money. In our case, we would be getting between 1.2 and 1.7 billion dollars a year. This is a lot of money. It would cover 280,000 Tennesseans who are in the gap. It would help to save rural hospitals. It would be a stimulus, probably providing about 15,000 jobs per year, and probably more if the economic multiplier effect is considered. There was some concern among some legislators initially that the state would eventually have to pick up part of the money. In fact, after 3 years, the state would have to pick up 10%. However, the Tennessee Hospital Association has realized that if they pick up that 10%, it will end up making them money because they will not have the burden of the uninsured moving into the hospitals. So this is a win-win-win all the way around, and there is no reason for us to turn it down. It's not going to cost the state anything. It's going to benefit a huge number of Tennesseans. It's going to save rural hospitals, and it's going to provide a huge economic benefit to the state. And why our legislator has not approved this is beyond me. And now I'm going to turn this over to Tony Garr.
Thank you. This is Tony Garr. I've been a lifelong advocate for health insurance and for equal access to health for all Tennesseans. I've been very fortunate in my life. My wife and myself and my 2 children are all very healthy and doing well. However, I know that there are circumstances in life, and sometimes it's just a draw of the cards, where some people are a little bit luckier than others. And the fact of the matter is that many of the people that serve us, serve our food, fix our, clean our yards, they make the beds at the motels where we stay at, they fix our cars, they do all these things for us. They are in the service industry and they help us. They are part of our economy. And yet we also know that they work for a small employer that does not offer them health insurance. They work, they get up every day. So I'm simply saying that we need to create a system that basically everyone has coverage and it's affordable, and they can get the health care they need. The fact of the matter is that Governor Haslam's Insure Tennessee would do that, and state legislators currently are blocking that. So it needs to pass. Like Alan said, it would not cost us anything. It actually would benefit us all. The reality is, by not doing this, it actually cost us more. Thank you.
I'd like to add one other thing. Although I didn't previously mention this, I would like to add that I have 2 children with type 1 diabetes. At one point when I closed my medical practice, Humana wanted $3,100 a month for me to cover the children and myself. That amounts to about $37,000 per year. At that time, the average income for a family of 4 in Tennessee was $49,000. If one considers $37,000 a year in premiums, plus copays and deductibles, it would have taken as much as virtually every family in Tennessee earns. Insure Tennessee is a part of the puzzle for helping people afford these expenses. These are expenses that are simply impossible for uninsured people to manage, and I really have to say that I think that it's criminal that the legislator has not approved this. Thanks.
Thank you.